Kate, a 20-year-old female, was playing soccer when her leg made contact with another player during a tackle. This tackle from the side caused a valgus force to the knee and resulted in a ruptured ACL. The paradigm. Kate's lifestyle is considerably active, working 5 days a week at a cafe, playing soccer on the weekends, and walking to and from uni. A subjective report from Kate highlighted a sensation of pain when standing. No comorbidities and no other relevant medical history. This paradigm is quite common in young adults. Toe taps is an effective way to organize your appointment because it affords the clinician a step-by-step process for structure and logic. The initial walk to the clinician's room would be a good opportunity for the clinician to observe and talk to the patient, as they are usually unaware they are being observed. The first contact with the patient is also a great opportunity to establish a rapport with the patient through small talk. For example, "Hi, how are you? How was your day? What brings you here today?" This basic conversation allows the clinician to establish trust, respect, and is likely to improve medical adherence. Before starting the testing for the ACL injury, it is important to conduct clearance tests. These tests are important to conduct as they provide insight into the patient's ability to don and doff any prescribed devices, or whether there are other medical issues missed or evident in the patient. These tests can be simple enough from moving from a sitting to a standing position or touching hands behind your back. During the clearance test, the clinician would also observe how the site of injury affects normal bodily function. For this case study, how much pressure can be applied to the ACL injury site before it gives way. Asking for permission before making contact with the patient is essential in clinical work. Bad practice is lacking communication with your patient and performing tests without permission. Good practice is being clear with what you are going to do and making sure the patient is comfortable. It is also important to consider asking if the patient would like a chaperone if they are uncomfortable. As range of motion is often limited due to an ACL rupture, the range of motion test is a great place to start. Align the goniometer along the greater trochanter and the ankle and ensure the pivot point is placed at the knee. Active and passive measurements should be obtained and recorded on a patient assessment form. Ideally, the clinician would measure the patient's good knee first and repeat the measuring steps on the injured knee. When repeating the steps on the injured or the bad knee, be mindful that the patient may feel pain or be uncomfortable. Remind them that if at any time they experience discomfort, they can stop the test. Once again, starting on the good knee, the draw test takes place when the knee is at 90 degrees. You need to sit on the patient's foot to improve stability. With your hands grasped around the tibia to ensure the hamstrings are relaxed, draw the tibia in a forward movement in order to determine how much movement is evident. In the good knee, less than 6 millimeters of movement is expected, rendering the anterior draw test result as negative, meaning the ACL is doing its job. Repeat the test on the injured knee, and if there is more than 6 millimeters of movement, this is considered a positive anterior draw test result, meaning there is likely an ACL injury. To confirm the results of the draw test, perform the Lockman test by flexing the knee to about 30 degrees, holding the hand on the outside of the femur and the other hand on the inside of the tibia, and moving the tibia anteriorly and posteriorly, feeling for excessive movement. Once again, repeat the test on the bad knee. Excessive movement confirms the draw test, suggesting there is an ACL injury. During the conclusion of the appointment, it is necessary to have a conversation about the results of the test. My concluding conversation with Kate highlighted there is likely an ACL rupture, as both the draw test and Lockman test results were positive. However, an MRI scan would be necessary to confirm the ACL rupture and if there is surrounding damage. I would provide her with a referral, ask if she has any questions before I concluded the appointment.